So today I have the privilege of introducing Dr. William Tseng. Dr. Tseng is a surgical oncologist at the City of Hope National Medical Center in Duarte, California. He joined City of Hope in 2022, but for the last 10 years has dedicated his career exclusively to the treatment of soft tissue sarcoma. Dr. Tseng takes care of all patients with sarcoma of the abdomen, extremity, and trunk, but is recognized for his expertise in retroperitoneal sarcoma and liposarcoma. He is active in sarcoma research with 50 publications in just this rare disease alone. He leads the sarcoma program at City of Hope and serves on the soft tissue sarcoma panel for the National Comprehensive Cancer Network. Dr. Tseng, we are very excited to welcome you as the opening speaker of the 7th Annual Sarcoma Exchange. The floor is yours.
Great. Thank you, Julie. Thank you for that kind introduction. And it's great to see everybody. Wonderful to see such a large attendance at today's meeting. Let me share my screen. Uh-oh. This doesn't seem to be working. I think it's my computer's issue.
And if you give me a moment, I will get your...
Yeah. That would be great. That's why I sent you the backup.
Give me just a second. Hold on, I have a lot of screens open. Why don't you start and I'll get caught up? Sorry about that. It's just taking a minute to download.
Sure. Well, I do need the slides, unfortunately. I'm sorry. It's a security feature on this computer that I'm using.
Okay.
There you go. Okay.
Sorry.
And Gail, I'll just say next when we go on. There are animations during the presentation. Okay. So go back to the previous slide, please. Previous. Yeah, there you go. Okay. So yeah, again, thank you for having me this morning. The title of my talk, I thought I'd make it a little more brief than on the program sheet, but it's basically saying, go see a sarcoma specialist. Next slide. And my disclosures, I only have one disclosure that is for up to date. Next. And for this talk, disclosures specific for this talk are that I am a surgeon and not a medical oncologist or any other specialty. I also am, I treat adults and not kids, and soft tissue sarcoma, not bone sarcoma. My practice is in academics and not community. And I also practice in Los Angeles in Southern California. I just say all this because some of the ideas and the concepts that I'm going to be presenting are maybe a little, I'd say, I wouldn't say biased, but at least it has this perspective. And it's basically what I'm trying to say is that these are my 2 cents. Next. And this topic has been very important to me for quite a long time. You could see back in 2018 when I first joined the Sarcoma Alliance and participated in the group. That was the title of an article I wrote for the newsletter, Go See a Sarcoma Specialist. Next. So the outline of my talk this morning will be divided as such. Why see a sarcoma specialist? What is a sarcoma specialist? And that is, as you'll see, it's still the controversial topic. And then number 3 is I put together a few slides about how to prepare for the visit to see a sarcoma specialist to get a second opinion. Next. So Sarcoma 101, just to get everybody on the same page, and this is just one slide. You'll hear a lot more about sarcoma throughout the course of this weekend. But sarcoma is very different from other cancers, very different. It's very rare. It only represents 1% of all cancers in adults. And it affects all age groups. So yes, adults, but also kids, elderly population. It spans the whole age spectrum. Unlike other cancers, there are no risk factors for sarcoma, meaning that it's not like smoking for lung cancer. There's also no prevention or screening. There's no mammogram, so to speak, as we have for breast cancer. So again, very different from other sarcomas, other cancers. It's also a very subtle presentation. It can be associated with symptoms, but often they're non-specific, vague, and they can, unfortunately, that can lead to the disease, the tumor being ignored for a period of time because it presents so subtly. Next. And then importantly, it's very challenging pathology. There are over 100 different what we call histologic types of sarcoma. What I have listed there are just a few of the different soft tissue sarcomas, liposarcoma, leiomyosarcoma, etc. And keep in mind, this is all within that 1% of cancers. So you have a very rare cancer, and then within that umbrella of rare cancers, many different types. It's also different in the sense that it is not organ specific. So unlike colon cancer, which is specific to the colon, or lung cancer, which is specific to the lung, sarcoma can occur anywhere in the body. And the most common is the extremity, the arms and the leg, that represents about 60%, but you could see it can occur anywhere in the body. Next. And then most importantly, the treatment for sarcoma is tailored to the type of sarcoma, that's the histologic type, as well as to the location. Next. So with that background, why see a sarcoma specialist? Next. So simply put, it's extremely rare, and then it is very challenging to treat. And unfortunately, the outcomes are overall poor, but of course, seeing a sarcoma specialist does help, as we'll get into. But because it's extremely rare and it's very challenging to treat, it is very important to see a sarcoma specialist. Next. So, for example, a sarcoma specialist can help you. Just stay there, please. A sarcoma specialist can help you answer some of these questions. What do I have? So we know it's sarcoma, but specifically what histologic type, what does that mean? What really is the diagnosis? And sometimes that comes from the pathologist. Many of you, as patients, will never see the pathologist, but the pathologist plays a very important role in the accurate diagnosis of the disease of sarcoma. You'll hear, I'm sure, a great talk from Dr. Lazar, who I know very well, later this morning. The sarcoma specialist can help to answer what is the best treatment. And I put best in bold because it may not be so straightforward sometimes. In fact, oftentimes, because of how challenging it is to treat this disease, the best treatment may not be what you have in mind. So certainly surgery is a major part of the treatment for most sarcomas when it has not spread, but it may not necessarily be the only treatment or the best treatment. Next. And in terms of surgery, because again, I'm a surgeon, so some of these are little from my perspective, but a sarcoma specialist can tell you and help you understand some of these very important questions. For example, as part of the surgery, if that is part of the treatment, but as part of the surgery, do I need to lose my kidney or any other organ you could put in there? Or importantly, do I need to lose my leg, like an amputation, leg, arm, And I believe Dr. Christ will be giving you a good lecture about that later this morning as well. Very important question. Is it inoperable? Sometimes when you see a non-specialist, they may think that the tumor is very big, just as an example. But they may say, oh, it's huge. Or they may say that it's already come back 2 times, 3 times. It's inoperable. And so that question, that very critical question of whether it's operable or inoperable, I think should be best answered by a sarcoma specialist. Next. And then in terms of medical therapy, chemotherapy, is this my only option? If you have a local medical oncologist that is in all good intention, but is not a specialist, telling you that we just have to give you chemo, maybe there are other targeted therapies, or maybe there is a clinical trial that's available for you that's specific to your sarcoma. So spent a lot of time on this slide, but this kind of captures in a nutshell all the reasons why I think it's important to see a sarcoma specialist. Next. And then most importantly, outcomes are better. So when you see a sarcoma specialist with the diagnosis of sarcoma, the outcomes are definitely better. Next. I put that Kool-Aid man there because some people don't believe in that, but I think if you drink the Kool-Aid, so to speak, you'll see that well, it's not just drinking the Kool-Aid, because next, there are plenty of studies in the medical literature. I have just a representative few listed there that do show that when patients see a sarcoma specialist, it's not just drinking the Kool-Aid or accepting that idea, but the outcomes are in fact better than patients who do not see a specialist. Next. The largest of these studies, and this is always kind of baffles me, that for just one country, France, they had 36,000 patients, and you could see the difference in the survival curves with better survival in patients who went to a sarcoma center in France versus patients who did not see a sarcoma specialist. Next. And of course, there is always an elephant in the room. So as much as I think everybody on this call may agree to see a sarcoma the importance of seeing a sarcoma specialist. As I said, there are very important interested parties, like, for example, insurance companies, that may not agree with this. They have, I want to say, other reasons for not agreeing with this concept of seeing a sarcoma specialist. And it is a real world, and we have to do our best to accept that. But next. But one of my goals, my wishes, my dreams would be that we could convince all insurance companies that it is important to see a sarcoma specialist. Next. And on to the next topic. What is a sarcoma specialist? So, and I found this image of the yellow pages. I realize now everything. I remember the yellow pages. I don't know if you guys remember the yellow pages, but I seem to never use the yellow pages anymore. But unfortunately, you cannot find a sarcoma specialist in the yellow pages. I haven't actually tried. You could try looking it up, but I don't think so. But anyways, what is a sarcoma specialist? Next. Next. So a sarcoma specialist could be a single provider. And I want you guys to think about that, because it can be a surgeon, it could be a medical oncologist, it could be a radiation oncologist, it could be a pathologist, and that could be a provider that is independently working, meaning not part of a sarcoma center. Next. Now, there are obviously sarcoma centers, and that's very important. And the advantage of a sarcoma center is that, by definition, being a sarcoma center, they should have all of these specialists together in one place. Now, depending on your specific situation as a patient, the priority in your treatment may be surgery. And so if there's not a sarcoma center that's close to you, it may be worthwhile to find a surgeon, that's not part of a center per se, who specializes in sarcoma. And then I also bring up pathology. So there are pathologists, and I'm not going to name any names during this talk, and I don't want to have any biases and say, go see this person or that person, but there are pathologists that are renowned for their specialization in sarcoma that are not part of sarcoma centers. But of course, if you can get to a sarcoma center, that would be ideal for the reasons that we said earlier, that all of the providers are together, they're working together, and discussing your case at, for example, the tumor board. So there is a sarcoma center, but just understand that there are single providers as well. Sarcoma centers also offer the advantage of having a radiologist who specializes in sarcoma, as well as other support services listed there. Next. And I also wanted to bring up the point that there are, of course, sarcoma centers, but I would also pay attention to the main campus versus network sites, or community sites. A lot of the major sarcoma centers, academic centers, they have community centers that carry their name, but are not necessarily sarcoma centers. So you kind of have to pay attention to where the providers you're going to see, where are they on the main campus at the sarcoma center, or are they out in the community? Next. And what is a sarcoma specialist? So I published this editorial in 2020, and this was representative of the United States as well as Italy and France. And again, this is just my 2 cents. But if you were to ask me, what is the definition of a sarcoma specialist? Next. It would be patient volume, the number of patients that is seen by that specialist or the center, the experience of the specialist or the center, as well as I think it's very important to contribute to the field, meaning contribute academically, research, participate at meetings, keep up to date with the latest treatment in sarcoma. So patient volume, experience, and contribution to the field. Those would be the three things that I would use to define a sarcoma specialist. Next. Next. And in these boxes here, I've listed some of those details. I don't want to spend too much time, and I think you guys have access to these slides. But on the right-hand side, those are the numbers that we, Sarcoma Alliance, and then publications, medical publications in the medical literature have made these threshold numbers to define what a sarcoma specialist in terms of a single provider versus a center. I also wanted to point out retroperitoneal sarcoma, that's RPS, that's small at the bottom of that box on the right. It's only 10 to 13 patients per year for a center to be called a center that specializes in retroperitoneal sarcoma. But there are even sarcoma centers that have volumes that are 2 or 3 times of that. So it kind of gives you an idea of how rare it is. So we're saying for a sarcoma center to have such a relatively small number. And then fellowship training in that upper box, practice dedicated to sarcoma. Again, this is my opinion, but when you're about to see that provider, you could very easily do a Google search to see if they, if their profile lists that they treat every other cancer, because they may or may not tell you that they are a specialist. And then society participation. So CTOS and MSTS are the medical societies that sarcoma specialists participate in, research, and I think importantly publications, because it shows dedication to sarcoma. Besides treatment of patients, direct day-to-day treatment, it shows interest and academic interest in sarcoma. Next. And then very importantly, the sarcoma specialist should have access to multidisciplinary discussion, or be involved in multidisciplinary discussion with all the other medical oncology, whether it's surgical oncology, medical oncology, radiation oncology. That again is the advantage of going to a sarcoma center. Next. So last few slides, how to prepare for the visit. Next. So number 1, be familiar with your history, or in what we call HPI, which is history of present illness. Prior treatment, if it's relevant, meaning if it's recurrent disease that you have. Know your goals, What do you want to get out of the treatment? And that could be something like palliation of symptoms, or it could be cure. Unfortunately, sometimes cure is hard to achieve right now. I wish I could say something different to that, but know your goals. And then learn about sarcoma. There's a lot of great resources, including what we have at Sarcoma Alliance. But learn as much as you can about sarcoma in preparation for the visit. Next. And then specifically what to prepare. These are just my suggestions and from the perspective of a surgeon. But at minimum, these things, these medical records. So pathology report to say what is your diagnosis, what is your histologic type, radiology report, clinic notes, and that is either your referring doctor or the oncologist that you're seeing, whether it's a medical oncologist or a surgical oncologist, and an operative report. Again, these are all just suggestions. It's not absolute requirements. This actually helps facilitate and make the visit more expeditious, I think. Next. And if you have other significant medical conditions, extensive cardiac history, that can affect the treatment that's being proposed. So the clinic notes, if they're available. Next, and then very helpful, but not required, are pathology slides and blocks and radiology images. I would say from a surgical perspective, the radiology images are definitely very important for surgical planning. Next. And then it sounds like this is quite a lot. Again, these are just suggestions, but this is just the most recent ones. So if you've had an extensive history of treatment, just the most recent ones. Next. This is what I mean by pathology slides and blocks on the left-hand side there. And then radiology images. So those are the CD. If you can actually obtain the CD, that is very helpful to especially at the visit with the surgeon. And I would bring this in advance of the visit if you can, whether it's have it mailed or if you're able to drop it off a couple of days before your actual visit with the provider. Next. And I say this again, these are all just suggestions because in the real world, at least in my experience, these records may or may not be available at your visit, or all the required records may or may not be available. All of what I've listed in the last couple of slides, that is supposed to be the responsibility of the provider's office or the provider's institution to do this. They have teams of people that try to get all the records, but unfortunately, because of the rarity of the disease and this and that reason, sometimes the records are not available. And so just to make the visit more efficient, those are suggestions. Some patients who have an extensive prior treatment of sarcoma even put together a brief outline, which I'm always very impressed with, and I always think that's very helpful. Next. And then, of course, your questions. That's probably very important as well, because well, it's very important don't have to explain that, but bring your questions. And I certainly would encourage you to have your provider make sure all of your questions are answered before you leave that visit. Next. So again, the main things are to be familiar with your history and prior treatment if you've had prior treatment, know your goals, learn about sarcoma. Next. And then I also just wanted to say, this is just, again, my advice, but please be kind and respectful as you are in anything in life. Next. Don't say some of these things that sometimes are said. I know it's a stressful time, but just please be respectful. And next. And it doesn't hurt to say thank you. Next. Next. And that's pretty much it. Go back to the last. Yeah, I just want to leave you with the previous one there. Thank you, Gail. So I'm a strong believer in giving patients with cancer hope. And as was mentioned in my introduction, my practice is exclusively dedicated to just sarcoma. I only think about sarcoma day in, day out, not any other cancer. So when I say giving patients hope, it's sarcoma patients. And it is important to see a sarcoma specialist, even if it's not feasible for you to see one. still stay hopeful because it's very important. So yeah. Okay, next. And thank you. That is my contact information on the left, and that's my email address. And I do have an Instagram page. You feel free to visit that. It's it's a business page, a professional page that I find educational, fun to do. So feel free to check that out and follow me on Sarcoma Surgeon on Instagram. Okay, thank you. Be happy to answer any questions.
Thank you, Dr. Tseng. It does look like there was one question that was asked in the chat, and that question is Epic/MyChart the industry standard for sharing medical records, or are there many other systems?
I would say that it is a very popular one that's used, and a lot of hospitals, medical systems, private offices do use it, but it's also not universal. And there's also different Epic systems. So at City of Hope, we do use Epic, but I've run into situations where another hospital has Epic, but the records or the images don't get transferred over, or we can't find them. So it's by no means a perfect system, even if it's Epic to Epic. But there are also a lot of other hospitals that do not use Epic at all. A lot of major sarcoma centers also do not use Epic.
Thank you for that. I think there might be just one more that came up. When you do a consult for a second opinion, if you don't agree with the other oncologist's opinion, would you share your thoughts openly, or is that frowned upon in the medical world?
Yeah, that's a great question. It depends. I think it depends on, as I said, be kind and respectful. And so I would not challenge the either of the oncologists to say, well, this person said this, be kind and respectful in terms of how you ask that question. And it's hard to say, because it depends on how you feel, how comfortable you feel talking to that person, how you ask the question. You could certainly ask. There's nothing wrong with it, so it's not disrespectful to ask the question. And I see a few other questions pop up now.
There are other questions. I don't know if you have a few minutes to stay after and maybe respond within the chat, but I do want to make sure that we're not getting
Oh, okay. Yeah, I'm happy to. I'll respond.
Okay, thank you.